Hello, everyone, and welcome to another Whiteboard Wednesday from Advocates for Human Potential. My name is Kristen King from AHP, and I'm very excited to invite you to today's session. We're going to be joined by two of AHP's experts, Linda Frazier and Patrick Gauthier, who are going to talk with us about implementing behavioral health evidence-based practices in accountable care organizations. So I'm going to bring Patrick and Linda on the screen with me. Here they come. Patrick is our Director of Healthcare Solutions here at AHP, and Linda is our Director of Addictions Initiatives, as well as a registered nurse. Patrick, Linda, what else do we need to know about you today? Patrick, you can go ahead and go first.
Thanks, Kristen, and hi, Linda. What else might you want to know about me? I've worked both on the provider side of the equation throughout my 30-year career, as well as on the payer side. I was a managed care organization executive, and now the last 15 years I've been consulting with government programs that are responsible for health and human services, as well as providers of behavioral health and other forms of service, and social services as well, which are in vogue today, thank goodness. And our Healthcare Solutions division is the consulting division of AHP.
Thanks, Patrick. Linda, what else do we need to know about you today?
Thanks, Kristen and Patrick. It's great to be here. As Kristen, you mentioned, I'm a nurse, but I have a clinical background in adolescent health, women's health, and addiction, mental health in the outpatient and inpatient settings. And I've been working on implementation of evidence-based practices for the last 20 years as a thought leader and a clinical operations leader in for-profit and not-for-profit settings. And I also spent about 9 years working in state government. So very familiar with the payer-provider network loop and fiscal issues and budgeting and billing. So happy to be here and talk about one of my favorite topics.
Thanks, Linda. So Patrick, before we dive into our discussion, can you give us a little bit of framing for today's conversation about evidence-based practice implementation?
Yeah, sure. I think probably the best way to frame it is to share a little vignette with you, a little story. As I was thinking about this topic of, implementing evidence-based practices as behavioral health providers and services, social services are being integrated in an ACO environment. To me, the best framing I can provide is beginning about 8 years ago, we started working with a national health and human service organization that had locations all over the US. I think they're in 30, 35 states. And their challenge to us was, how do we select, and more importantly, how do we implement a care coordination model in every state in which we have operations or a presence? And that's a tall order. It was a tall challenge for us to have something that was coast to coast, but needed to implement a new model. They had wanted that process to include a recipe, if you will, for really thorough implementation, as well as a continuous quality and performance improvement cycle. And we saw that as amounting to evidence-based practice adoption methodology, or an approach that reinforces just how crucial the workforce is to quality service delivery. And of course, that's the umbrella for the work that we're doing in these presentations, is that how do we bring back whatever this challenge is to the workforce? Because it's our belief that the workforce is a cornerstone of everything that you're trying to do. The three questions emerged from our work with them. The first was, how do we select the right evidence-based practice, the evidence-based practice that's going to make most sense for our workforce and the people that they serve? The second question that goes to framework is, how do we then thoroughly implement that evidence-based practice across a workforce that's distributed across 35 states, and to do so consistently? How do we make sure that what we do in one state is the same as what we might do in another? And thirdly, how do we evaluate our adoption and deployment of that evidence-based practice to demonstrate that it has in fact improved our quality of care and our clinical outcomes? So again, evaluation. That's the framework that I think we ought to explore with our time together today.
All right, Patrick, that sounds great. And that's a good broad context, because we're all dealing with the challenges related to the current public health situation with COVID, which can exacerbate some of the challenges that we might have been able to address by being in the same room together. And so this conversation is important more now than ever, I would say. So, you laid out a really solid framework for, what kind of needs to happen for this to work well. So let's talk about those questions. And Linda, let's start with you. How do we select the evidence-based practice that makes the most sense for both our workforce and the people that they're serving? What do we do there?
It's a really good question, Kristen. And I think it flows nicely from the story that Patrick started us with, which is, most organizations don't have a lack of input about evidence-based practices that clinicians or staff have heard about or clients have asked about. So it's really about doing the research to make sure that what you're considering implementing is best practice, that it's not best practice from 20 years ago, but it's current. But it's also, looking at organizational fit, looking at consumer fit, having leadership and capacity within your organization. In other words, you just don't want to go to the research articles and pick an evidence-based practice off the shelf. You want to consider the context, your context. Who are you serving? What are their needs? What are the outcomes you're trying to impact? Is the evidence-based practice being proposed actually a good fit for what you need to accomplish, either from an outcomes perspective or from a payer strategy perspective? So there are a lot of considerations. It's not as easy as just, wow, here's the new flavor of the month, which is frequently one of the things that happens in conversations in organizations when you're thinking about what fits with your vision and your mission, is, really making the case that this is the right practice in the right time for the right population. So those all need to be considerations. And so, asking your clinical staff, what are the things they're using that seem to be working? What are the things they wish they could use more or they had more capacity to use? We've got one clinician, but wow, this is really working well, and a lot of people really like it. We'd like to make it something we just do as the way we do business. Okay, what do we need to do to implement it from that perspective? So you may already have capacity, you may already have trained people, but maybe this is an implementation project about spread. Or maybe it's a new practice and you need to first build capacity and think about how it works. Would it work in your setting? What's your culture? What's your clientele culture? What kind of service do you offer? Do you offer long-term ongoing service? And does this evidence-based practice sit well in that kind of a practice? Or is it a shorter term kind of practice that can be used with people that you only interact with in small doses, and people come and go in and out of the system? So those are all things you need to be thinking about. And then I guess the last thing I'd say is just, as you hone in on that practice, making sure you have executive leadership support and buy-in, because no matter what case you make about the importance of this practice, if you don't have that kind of leadership support it's really hard to be successful and sustain your implementation.
Thanks, Linda.
If I can,
yeah, please.
Yeah, I was just wanting to underscore something, and that is, the state in which you operate, and it might be down to the county level or even at the level of the city. It might be in a relationship to a particular insurance company or funder. Remembering that what we're talking about here is behavioral health, evidence-based practices being implemented in an ACO, an accountable care organization, which of course is a very diverse, highly integrated system of care, with hospitals and clinics and primary care and all the specialties. And I think it's important to consider what is happening in that integrated system of care, what's happening at the state level from a strategic standpoint. So, and I'll give you an example at the national level. Just this week, the Healthy People 2030 measures were announced and released by the United States Department of Health and Human Services. And they become a target, if you will, for the measure of our health and well-being. And they've included for the first time social determinants of health. So you may have at the state level a state saying strategically we want to address social determinants of health. The ACO in that state may be saying to itself, well, if the state wants to do that and the federal government wants to do that, why then it'll become a strategic imperative for us as well. So as a distinct specialty within the ACO environment, behavioral health might want to be looking vertically throughout the organization to say, what is everybody else striving for? And is this evidence-based practice going to suit this strategic imperative? In other words, are we barking up the right tree, advocating for this practice? Is it going to support the goals and aspirations of the ACO in the context of the state? So it's a sort of a vertical view, I refer to it as.
Yeah, well, and I'm really hearing from both of you how important both the suitability piece and the scalability piece are, because if you don't have the capacity, you may need to scale the capacity before you can scale the practice, right? The practice may be something that's relevant to only one portion of your organization, but you can take it to scale there, even if you don't necessarily need or want to take it to scale elsewhere. So there are a lot of questions to answer as you go through this process of identifying what you want to do. So let's talk about the implementation piece. And Patrick, I'm going to turn to you first on this one. Once we've identified, and say, maybe we have more than one, but just one for now, how do we implement that thoroughly across our workforce in 35 states and do it in a way that is consistent and that actually makes sense for the organization? How do we tackle that?
Right. Well, I'll tell you how we tackled it in the case of the story that I was sharing, because I think it's a great illustration. And that is, to begin with, and it doesn't seem to be, for a lot of people, part of an implementation strategy. It might be pre-implementation. And whatever the case may be, I think it starts with market research. And because what you heard Linda describing is getting to the nature of the problem for the people that we're serving in this location and the people who are serving them in this location. That's the establishment of fit. Well, if I have operations in 10 locations, in 10 states, or in 30 states, it doesn't much matter. I need to consult with my market research folks. Perhaps I've got some epidemiologists on staff who can help me understand this particular problem that we've strategically identified as something we want to address. Is it in fact the same problem in all 10 locations? in all 10 communities, in all 10 states? Or is it somehow different? And from those different perspectives, then we're going to be able to establish the need or the demand for the implementation. And I'll use just a very silly math here, but if I have 5 people who need something in one location and 5,000 people who need the same thing in another location, that's going to affect the scale of my implementation. Implementation in those 2 different locations will be very different. So it helps to have that market research done, to have the epidemiology done, really helps me to target my initiative and starting to pilot where I think I'm going to have a positive impact. I'm going to learn some lessons and be able to spread that across to different locations. Some of these evidence-based practices can be adapted, modified somewhat to suit differing contexts, and some of them can't. So if I find that in my location number 2, the problem is quite a bit different, the population I'm serving is quite a bit different, we may forego implementing this practice in that location. It might not be a good fit. So the amount of work that needs to take place up front to establish that in more than one location, I think is critical work that has to be done. It's tempting to do it lightly or to not do it at all, having established a rationale in one place, but I really highly encourage it. Then, and this is real important, next step is to conduct an organizational assessment of readiness, which is why we've provided for you a checklist. And you're going to hear about that checklist a little bit later. But you have to assess the organization's readiness to implement this evidence-based practice. Do we have the right people? Do we have the systems, software and otherwise, to support? Do we have the data to support this evidence-based practice? How are we going to know if it's effective? We have to have that data. If we don't have the people with the right training and certification, perhaps, is there a training program readily available? Is there an expert who we have identified that can come in, train our people? Do we have a sense of how this new evidence-based practice is going to address other strategic initiatives we might have? For example, health equity is on top of everybody's minds today. Is this evidence-based practice culturally relevant? And you heard Linda speak to that. Do we have the staffing to manifest that cultural relevance up to and including language? If we have a population that's a Spanish-speaking population, can we deliver this evidence-based practice in Spanish? So those are very important things to assess. And then I think planning, the implementation planning stage, particularly for something that might span 1, 2, maybe even 3 years, is going to require sophisticated planning and professional project management and long-term support from the executives that Linda raised earlier. I think in my experience, this is where most folks underestimate the time it's going to take, the staffing that needs to be dedicated to it. And as a consequence, I think it's where a lot of evidence-based practice adoption can fail. It's just an underestimation of how long and how concerted an effort it will be. And if you're going to be replicating this practice in other sites, you need to be asking yourself all the while that you're piloting it in one site, when are we going to be ready to take this to a second site? How are we going to do that? Where, what is that second site going to be? And to know what your criteria for expansion are before you make those decisions, having those criteria really nailed down. Linda, you've been through this just as well as I have. What am I leaving out? I think we've lost Linda's audio.
Yeah.
Sorry.
Here. Oh, there you go.
I just realized I put myself on mute so I wouldn't interrupt. Sorry. I was just saying, Patrick, I think you hit the really important points. And I have to say that the organizations we work with, the ones that are the most successful are the ones that know they're in it for the long haul. And the ones that struggle are the ones that think somehow it's going to just take a little bit of attention at the beginning, and then it'll be all set and it'll run by itself. And the fact of the matter is, this is continuous quality improvement, really, at base. Implementing evidence-based practice is sort of monitoring what's going on, tweaking your services, and always being ready to figure out what you need to change up and how you need to change it up and how you're going to measure if it's working. So it takes attention, it takes resources, and it takes commitment. And if you don't have all of those, you're not going to succeed.
Mm. I have a question for both of you before we move on to the next big topic. You both mentioned how important it is to really, ask a lot of questions and do this assessment up front, and that it's really tempting to, maybe cut that shorter or just underestimate how long it takes. Percentage-wise, of that implementation process to where it's up and running and ready for the continuous improvement piece, like how much of that time, percentage-wise, is really spent on the readiness versus how much is spent putting it into practice? Could you even take a guess at that? What do you think?
I'll take a stab and defer to Patrick. He may have other thoughts. I really think it depends on the organization. It depends on the size of the organization. It depends on the size of the implementation. My cautionary note is you can err either way. So we do a lot of coaching of sites that want to spend all their time in planning but never get to execution. Mm-hmm. And then we coach other sites who are too ready to execute but don't have their homework done, or don't have their metrics in place, or don't even know if they can capture information to know if what they implement is actually working. So it goes both ways, and it really depends on the practice and on the setting and on the organization.
Mm-hmm, mm-hmm. Yeah, I would concur, and if I had to give you a percentage, I would venture to guess 10-15% of the time being devoted up front to ensure that the implementation is going to go well, and then having 80% of your time then reserved for the implementation process. And I think what Linda had to say is spot on. The only other thing I might add is how robust an implementation team you have.
Yes.
If you have an implementation team of 3 people for, what is admittedly a very large implementation, those 3 people are going to struggle. They're going to have to work day and night and run as fast as they can to properly implement, and you're going to burn them out. So that's a dimension of implementation that needs to be talked about, and that is, how big an implementation team do we need to have, and are those people aware that they are to dedicate X% of their time to this, and they will be evaluated accordingly. They need to know. They need to have been given, permission.
Yeah, I was just going to say, not only are they aware, but they also are recognized and have the time and resources to devote, which gets at that executive champion piece being so important. Is people need to be acknowledged for the work they're doing, and there has to be space and time and resources for them to support them in being able to do it.
Thank you. Yeah, I'm really hearing that there's a sweet spot there, but it's not one size fits all. It's different for each organization. And that's why asking those questions up front and really investing the time to find out how long it is going to take to do it the way your organization needs is so important. So Linda, let's say we've selected our EBP, we've rolled it out. how do we then evaluate the adoption and deployment of that practice so we can demonstrate that it actually is improving the quality of care and having a positive impact on the clinical outcomes?
It's a great question, Kristen, and I think it's one that can be overwhelming. Because there's, as you just said, I'll take there's no cookie cutter approach to this. So in figuring, knowing how to know if what you're doing is working requires different kinds of metrics and measures. And some of those are more process oriented, some of those are more outcome oriented, some of those may be driven, as Patrick said, by your state strategic priorities or your payers. And most importantly, some of those things are going to be around consumer and staff morale and buy-in and understanding of what you're trying to do. So sort of getting everybody in the same boat and on board is a measure of whether you're doing your job right. That doesn't tell you whether you're actually getting the impact from an evidence-based practice, but it tells you that people are on board and understand what the organization is trying to do, and aren't going to inadvertently create challenges or barriers to your implementation plan. So metrics are important, and they're important from the very beginning. You know, what is the evidence-based practice? Do you need to have measures that are around fidelity to a model or a practice or a protocol? What are the outcomes you're looking for, and how do you measure those? And are those measures that you have in your EHR? Are those measures you need to do for the state? Do you have the capacity to integrate all the different measures you need and report them out in a timely fashion so that people can see what's happening? Or you may have measures around quality, you may have measures around cost. Does your implementation plan outline what the resources are and what the costs are? And is your IT department running over or able to meet the timelines in order to support you in having the measures you need? So there's a lot of data and metric considerations. You know, sometimes you have the resources, or you can build into a plan because you're working with a state payer or a state organization where there's a large formal outcome evaluation. Those are great projects, but in the world of evidence-based practice, some of those outcome measures are things we won't really be able to see or assess for a year or two. So the other measure I encourage people to think about is sustainability. Are you pilot testing implementation? Are you fixing challenges that come up? Are you tweaking your systems? Are you sharing your data? Are you making sure everybody understands why you're doing this, who it's targeted towards, so you get the right people receiving the right service? And how is that all working towards sustainability? Because it's going to take you 2 or 3 years to really be able to judge in the long run if the patient outcomes that you're seeking are really there. And there's going to be a lot of process data and other ways of measuring that you're going to need along the way to help you stay on course. That's the big picture, high level assessment of how do you know if it's working. But it's a lot of day-to-day team assessment of what's going on and where are we hitting kinks and challenges. Patrick, you may have some other thoughts on this.
You know, just a couple of quick notes. I think, and I know there's a little bit of an echo, so forgive me if it's my system that's echoing, but I think talking to, you know, this is akin to management by walking around. There is an evaluation that you can do as a leader by talking to your own staff throughout the implementation and asking them, how's it coming along? And just having some one-on-one sit-down time with people at their desk to say, look, I know you've been at this for a few months, and give me your, your opinion. How is it coming along? And you might even do a small focus group with some of your consumers or your patients, your clients, however you refer to them, and ask them. We've been doing some different kind of work with you now for X number of weeks or months, and how are you experiencing this? What's your experience with this care? And I think the other thing I would add to what Linda said, because she really covered a lot of ground there, is transparency. When the numbers do start coming in, if you are working with an independent evaluator or you're doing it yourselves, to share your findings or the findings of the evaluator with all of your staff at all levels, so that everyone is benefiting from the feedback. That data is feedback. And there is one more thing, Linda, and then I'll stop. This goes to the point we were making earlier about doing your market research, and that is establishing a baseline for all of the metrics, all the different measures that Linda discussed. You need to know where you're starting. And it's very frustrating to get 6 months into an implementation and then think, oh, we need to evaluate, and suddenly we've lost the baseline data. That data was there for us 6 months ago, but it's not there anymore. So make sure you establish your baseline data with your early market research. That's going to help you then with a benchmark, that gold standard, and measuring progress toward that benchmark.
Really good point. I should have said that from the get-go, but yeah.
Well, thank you so much. This time has flown by. We're coming up on the end here. So I'd like to, we have one question from the audience that I would like for us to tackle. And then I'm going to suggest we move toward wrapping up. So I'm going to pull this question up on the screen. So this question came from Sarah, and she's asking, who should be part of that decision-making process and team when an organization's deciding on an EBP? And then I would also add, who should be part of the team that's doing that evaluation as well? So I'll let either of you take this one.
I'll take a stab at it. The decision-making, at different points in time, it might be different people, but you always are going to need executive champions if you're going to be successful in this. Who's on the process and implementation team is something we know some things about. It's always helpful to have frontline staff participating in some way, somebody from operations, some clinical leadership. Again, clinical leadership, clinical director, someone who's tied to clinical staff, can communicate to and with clinical staff, and also can reinforce, and all of those people need to see themselves as communication conduits. I've loved what you said, Patrick, about managing by walking around. The way to do this successfully is for that team to be known as the go-tos, and be listening and have their ear to the ground, and also be sharing transparently information out so that you can tweak and deal with systems issues, because nothing comes out of the box perfectly. And the way to make it successful is just like practicing violin or flute or soccer. You figure out which moves work and which ones maybe didn't do so well. And just because you missed the note or missed the ball once doesn't kill the project. And so that team needs to represent the organization. It needs to represent people who have their ears with clients, with clinicians, with IT people, and can raise those issues. And that team needs to be given time and space to meet, to be able to address issues as they come up.
Yeah, I think what I might add to that is and I think this is especially true in the ACO construct or context, is there may be community partners that are involved in the full deployment, the full implementation of the new practice. So you may need to include some of those partners, have them at the table from the beginning. And I would just echo what Linda was saying about a multidisciplinary team. Executive, finance, IT, clinical, and again, in an ACO environment, medical director, nursing director, you name it. If there's a specialty, and I'll give you an example. In an ACO, there might be a focus on pediatrics and behavioral health, and so they're implementing a practice that's going to affect pediatrics and behavioral health and the care coordination, across that spectrum. And so having your lead or several folks from both pediatrics and behavioral health at the table together, and knowing the outcome we're trying to produce is to reduce, it might be childhood obesity. Well, now we need to go into our electronic medical records and make sure that we're measuring, body mass index and weight, and that those measures are being captured in our EMR, and we can continue to capture them and measure change over time in this group of kids who are participating in this pilot. So you can see very quickly that it's a multidisciplinary exercise, and that's why we were saying earlier, if you're trying to do this with 2 or 3 people, it ain't going to work in this context.
Well, and just to add to that briefly, depending on how many sites you're doing and what you're juggling, you may have small implementation teams that report back to a larger implementation team that get at the local level issues and help you standardize across all your services while being sensitive to individual site needs.
Thank you. I hope that answered the question. That was really helpful. Now, I'm going to ask for 2 things. Patrick, I'm going to ask you to kind of put a bow on this for us and sort of bottom line our takeaways. And then Linda, I know you have a great resource to share with us. So Patrick, you can let's have you laser focus on our big takeaway for today, and then we'll let Linda close this out with sharing our resource.
All right. Here's my laser focus. Adopting evidence-based practices in these large integrated delivery systems requires focus. There's no question it requires a process, a methodology. There's no question about that. But it also requires a recognition and an appreciation for it being about people. It's about vision. It's about leadership, things that really matter intrinsically to people. Your clinical staff, your line staff, need to believe that the practice is going to support, help, improve the care of the people that they're serving. This is about people helping people, and we can't lose sight of that. Successful adoption is about these multiple disciplines working together and learning to communicate together, learning to share an outcome and a process together. And then, of course, it's about ensuring that your workforce grows as a consequence, that people feel like their island of knowledge is growing, and that their practice is growing, and that they're going to be viewed as more valuable intrinsically to the organization and to the people they serve. So without saying too much more about it, this is real technical work, but fundamentally it's about people. And, I want to wrap up too by telling you about the organization that we worked with, the one that I raised at the beginning of our time together. That's again a national organization. They learn to eat this elephant, the proverbial elephant, one bite at a time. We had to go slowly and bring it to scale slowly from one location in one state to another. The model was selected, it was rolled out, it was piloted until a critical mass could be reached to bring it to scale. It was a very careful spread of new care coordination practices that then matured and enabled them to grow their workforce. Their workforce literally grew into the practice of care coordination. So it was their people that were enhanced. Their patients were served more fully. And today that practice continues to spread.
Thanks, Patrick. Linda, tell us about our checklist that you all mentioned earlier.
Sure. So you'll see in the chat a link where you can download this 5-step checklist for implementing behavioral health evidence-based practices. So you can grab that and download it. You're also welcome to explore more about AHP's services and how we can help with solutions for real systems change at ahpnet.com. And this has been terrific. I've appreciated your time and look forward to more conversation.
Thank you so much. All right, I'm going to bring us all back on screen so we can say a quick goodbye before we wrap it up. Linda, Patrick, thank you for spending this time with me today. Thanks to those of you who submitted questions and comments in our chat. We look forward to seeing you next time on Whiteboard Wednesday. Have a great rest of your day and a great rest of your week, everybody. Bye.
Take care.
Bye.